and welcome to today's edition of the Research Sofa. I'm here today talking about food insecurity with Charlotte Hardman, who's a senior lecturer in psychology from the University of Liverpool, and Joe Smith, who's a consultant dietitian from Tees, Esk and Wear Valley's NHS Foundation Trust. So, Charlotte, can you tell us a little bit about food insecurity and what it means and what it is, please?
Sure. So food insecurity basically means having limited access or availability to acquire sufficient foods that we need for a healthy, nutritious diet. And that might be for various reasons. It might be that people aren't able to afford these types of foods, or that they're not available in people's local communities. So food insecurity is a real growing problem in the UK and in many other westernized countries. It's before the pandemic, it was estimated that around 8.4 million people in the UK were food insecure, but this has now really escalated during the pandemic due to the financial implications that the pandemic imposed on many people. So we really need to be concerned about food insecurity, because if we don't have access to sufficient healthy foods, that's going to impact on our health. And it's likely that food insecurity is a major driver of socioeconomic inequalities that we see in health outcomes of serious conditions. And we also see food insecurity being associated with things like obesity and also mental health problems. So this is where we start to see all these sorts of health and social issues sort of converging around food insecurity. It's a very complex issue, but something that we really need to address.
Great, thanks. Well, not great actually, not great that people are suffering from food insecurity, but thanks for that introduction. And Joe, could you just tell us a little bit about how this, what Charlotte just told us, relates to people with severe mental ill health, please?
Yes, certainly. So as Charlotte's alluded to, we know that there's around pre-pandemic 8.4 million people in the UK who have a degree of food insecurity. But for people with severe mental illness, it's disproportionately higher for people with severe mental illness. So there isn't a lot of UK-based evidence around this. A lot of the evidence that we've looked at in our recent systematic review has come from Australia or from the United States. And we've looked at the figures for food insecurity in people with severe mental illness, and we think it ranges between 25% of people to up to 70 people, but we think it's around half of people with severe mental illness have experienced a degree of food insecurity at one time in their life. So obviously that's a worrying number. And what people are telling us is it's not as straightforward as having access to food. It's much more complex, as Charlotte has said, than just access to food. So we're looking at fuel poverty, particularly with the rising fuel prices at the moment, but also access to the equipment and the resources to be able to prepare food, as well as having the knowledge and the skills to be able to prepare those foods. So it's a very, very complex picture for anyone with food insecurity. But what people are telling us is it's actually far more complex when you're managing a condition such as schizophrenia or bipolar disorder, as well as food insecurity. And we know that people with severe mental illness are more likely to be overweight or have obesity than people who don't have a severe mental illness. So it's not quite as straightforward as thinking, well, actually everybody with food insecurity is potentially malnourished, because it doesn't matter what your BMI is. You could be overweight or live with obesity and still be malnourished because of food insecurity. So it's around people having access to enough food to meet their basic nutritional requirements. So that's for energy, for protein, and some of the vitamins and minerals. And we're finding that people aren't able to meet their requirements. And also, we don't assess for this in routine mental health practice within the UK at the moment. So people are coming into hospital or coming into our services, but we don't ask them if they've got enough food. And it's quite a difficult subject to discuss if you're not asked the right questions. There's a lot of stigma attached to food insecurity. So it's really important that people who are working in mental health services are aware of this issue.
Thanks, Joe. So Charlotte, what do you think are the next steps? What do you think we need to do to help reduce the food insecurity that people are experiencing?
So at the moment, the general response to food insecurity is food banks, which I'm sure most people are familiar with food banks. But food banks really are, this is a last resort. This is emergency provision, and we really shouldn't be in this place at all. But it's certainly not a long-term solution. So we really need to be looking at upstream policy changes, to be honest, looking at social support benefits. Universal credit had a massive influence on food insecurity. So there's all these sort of upstream drivers that really need to be changed. But I think in sort of the shorter and the media term, it's looking at, well, what can we do? How can people be supported? There's really great examples of work going on in communities here in Liverpool around community shops and pantries. So this is all sort of like a membership-based scheme where members pay a sort of nominal membership fee, and then they can actually go and purchase a whole range of different foods which meet nutritional needs at a much lower price. And these sorts of models, there's loads of advantages of them, but one of the sort of the key benefits is sort of that inclusivity and bringing communities together, because as Jo mentioned, it's a very stigmatizing experience, and going to visit a food bank is not something that's pleasant. So if you can actually kind of bring back the community and sort of this idea of community shops, there are probably going to be lots of other benefits to people's mental health and their well-being, just around connecting with people and that sort of feeling of social connectedness. People are also going to need specific psychological support as well. So our research has shown, so this is not specifically with people with severe mental illness, but that for anybody being food insecure is really stressful. And then when people are stressed, that has effects on our appetite and our eating behaviour. And often people can use food as a way of coping. So we've shown some evidence in some of our research of that being associated with food insecurity. But certainly the work we've done with more general populations has really highlighted stress, mental health as being something really important, and giving people coping strategies and ways of managing this very difficult situation, but within the constraints of their own environment, because not everybody has got access to a kitchen, for example. So while cookery sort of lessons or advice might help some people, if you don't have access to those sort of facilities where you live, then that's not going to be helpful. So I think we really need these sorts of tailored approaches and working individually with people to understand what's going to work for them and support them.
Thanks, that's really interesting to hear about the pantries project and things that are setting up in local communities. Sounds like a really good initiative for people. And Jo, just over to you, what do you think we need to do next in terms of people with severe mental ill health and how to support them?
So I would absolutely agree with everything that Charlotte has said. I think in terms of severe mental illness, the first thing we need to do within the UK is to try and get an idea of what the prevalence of food insecurity is for people who are living with a severe mental illness. So that's the first thing we really need to gauge, kind of how many people this is affecting, but also what have their experiences been of food insecurity, and starting to think about, rather than going in and kind of having our own thoughts and ideas about what would actually help, it's trying to get this from the service user's point of view. So doing some co-production work and really listening to what service users feel is going to help them to access food. And a lot of the things that people have told us about are things like peer support. So although there's things in the community at the moment, like Charlotte's mentioned, the food banks, up here in Middlesbrough, we've got things called the eco shops, which is where you pay a nominal fee and you can take away up to 10 items. Now, there are things available, but there seems to be a barrier for people with severe mental illness in accessing some of these things that are available in the community, and whether that's because they don't know they're there, or whether they need that support to have the confidence to access these things for the first time. And that's something that has been mentioned to us by several service users. It's around peer support, but also thinking about the wider detriments, really thinking about addressing fuel poverty, as well as addressing things like equipment and helping people to have the skills. So it's taking that very holistic view as well to the food insecurity.
Well, thank you both for a really fascinating discussion about food insecurity and really highlighting the importance of access to food, and something that can easily, I suppose, be taken for granted in the Western world, and highlighting that isn't the same for everybody here. So thanks for joining me today on the Research Sofa. Thank you very much.
Thank you.
Thank you very much.